Give you guys a taste of what's going on around Western New York and things that you can do in your own lives, ways that you can tap into what's going on.
And so we believe in a holistic approach to that, and we believe that all of these things are in concentric circles, so we can't solve one problem without solving them all, right? And so we believe that we don't do things in silos, and that localism is a powerful economic and community tool, but also it's addressing all the health and wellness that we're speaking about today.
Let us then do the determination that we probably thought that there might be some connection between lupus, the reason that people were getting sick, and some things that were happening right there at the intersection of East Ferry and Grider. And that was a plant that had been in business as a copper smelting and zinc plant.
Always talking about how certain chemicals are affecting our children very specifically. The goal is obviously to protect children, but also their caregivers. Later in the PowerPoint, we see that 98% of caregivers that are registered and licensed in New York State are women.
Like brick, stone, wood. Since the Second World War, we have a lot more composite, synthetic materials. We're using a lot more chemicals. We have insulation that is made up of nothing but chemicals. So what we're putting into our buildings can be quite hazardous to our health.
Decisions about the products we use are never easy, but there is always a choice. A healthier path to accomplish the results we want to a better quality of life. The choice is always yours.
We began about 6 years ago. Literally residents in Tonawanda, New York, who noticed there was a lot of health problems in their neighborhood. So they met around the kitchen tables, got together, and thought that the problems they were seeing, the high incidences of leukemia, breast cancer, asthma, respiratory illnesses were tied to the 53 industrial facilities in their neighborhood.
And we have the opportunity to focus on pollution prevention, and that really is not pollution control, which oftentimes people mistake that for. It's not focusing on the end of life and compliance and regulations. We do have regulators to try to do that. It's really focusing more on being proactive. How do you reduce waste at the source? How do you design better for the environment? How do you incorporate sustainability and that triple bottom line that Sarah mentioned? How do you live in better communities? How do you integrate the community into what you're doing? Target companies to get them to change. So for example, the Breast Cancer Fund succeeded in getting Campbell's to make a commitment to get out of bisphenol A in their food can linings. They're now targeting Progresso. Those kinds of campaigns work. Earlier this year, Graco announced that they were going to stop using halogenated flame retardants in their baby car seats. So those kinds of victories are also occurring on the national level. And so there are many, many other ways that you can make a difference. And then if you're interested in talking more with them, go to that table. Someone who can report back and talk about your discussions and sort of the top line things that came out of that conversation. Hopefully that includes some solutions. One of the major things was that we're truly all looking for the same thing. And then the other thing that came out was that for a lot of these projects, it really only takes one champion or one person to kind of spur that idea and get other people moving.
The environment that we inherit, because we as grown-ups, right, we have to look forward to the future with their children.
Kind of these crazy consumers who, what we want to do is buy, and so
unless we kind of curb our consumerism, we may not be able to shift towards kind of a healthier economy.
And researching areas and how can they change that area into community gardens.
So, talked about focusing more on local economy and that you have a lot more accountability when the goods that we use are produced locally. You know where they're coming from.
So now is the time to look for prevention for everything that we're doing, for the future.
If you eat and use natural products, then you will be healthy. And in the long run, it's going to be less expensive because you won't have to spend on medical bills.
So that you can broaden your own network and learn more. And this is a great way to do it, to come to events like this.
All of our issues intersect so interestingly and so important. It's so important to look at how those things intersect, and that imagine what would happen if all of us were able to work together like this frequently.
Baker had to leave early, but you reminded me that while we're talking about the connections between women's health and the environment in terms of what the environment can do to harm us, if you look around the room, there are a lot of really powerful women who are doing a lot of really powerful things, and women have really been at the forefront in many of these movements, making change here in Buffalo, here in Western New York, around the country and around the world. And so it's not just about the impact it has on our lives, but the impact we can have for the lives of the people around us and for future generations.